Among heart conditions, atrial fibrillation is the most common arrhythmia, with the expectancy of atrial fibrillation cases to double by the year 2060, putting large stress on the medical system. During this presentation, we'll discuss the pathophysiology of atrial fibrillation and the current treatments. We will also discuss the need for more successful drug treatments, including the novel drug Vernakalant. This particular drug has shown promising effects, as the data shows it's a good rhythm control drug that's highly selective, which reduces events as Torsades D-points. Atrial fibrillation occurs when abnormal impulses are formed, whereby an atopic region of the heart assumes pacemaker activity. This region initiates action potentials that fire more regularly than the sinoatrial node. Abnormal impulses are either called early after depolarization or delayed after depolarization. These depolarizations lead to uncoordinated atrial contractions, reduced stroke volume, and in turn, cardiac output. Unlike current pharmacological rhythm control treatments, Vernakalant has a short half-life of 2 to 3 hours. This reduces the time it takes for a therapeutic response and reduces drug-to-drug interactions due to its rapid elimination. Within Australia, treatment of atrial fibrillation cardioversion is commonly achieved with either flecainide or amiodarone. The major disadvantage of these drugs is the potential to induce ventricular arrhythmia, leading to TDP, while Vernakalant has been found to be more atrial selective. Vernakalant is a new pharmacotherapeutic agent in the treatment of atrial fibrillation. To prolong the action potential duration, Vernakalant blocks both voltage and ligand-gated potassium IKUR, IKR, and IKACH. These are blocked and prevent repolarization. The refractory period of the action potential is also increased due to the blockade of sodium channels, predominantly in the atrial tissue.
Though Vernakalant has been demonstrated to be highly effective in promoting rapid cardioversion, it has also shown an increased risk of adverse effects. In the short term, it has been associated with dyschezia, sneezing, and nausea, as well as some more serious adverse effects such as bradycardia, hypotension, and heart block, all requiring immediate intervention to ensure patient safety. The strict exclusion and inclusion criteria of the studies has caused gaps within our knowledge, and as such have formed part of the current contraindications in the European guidelines. These European guidelines indicate Vernakalant for the acute treatment of atrial fibrillation, that is with patients with duration of less than 7 days, or in patients with a recent operation less than 3 days. All patients must have a systolic blood pressure of over 100 milligrams of mercury, no history of acute coronary syndromes in the past 30 days, no QT prolongation of above 440 milliseconds, and no class 3 or 4 heart failure. These same considerations do not have to be made for amiodarone and flecainide. It has been shown to be very effective in the treatment of atrial fibrillation for rapid cardioversion, with an average of 42.3% of patients reaching cardioversion within this first 90 minutes. It has only been tested in placebo studies, except in the Avro study where it was trialed against amiodarone for efficacy. This trial was skewed towards showing the efficacy of Vernakalant, as monitoring was ceased after only 4 hours. Amiodarone will typically take 6 to 8 hours to reach cardioversion. None of these studies have included any long-term patient follow-ups to rule out the reversion of atrial fibrillation. The adverse effects have been noted in frequency, though not severity, though many of the studies who did have severe side effects did note their management of these. The lack of information for the severity may put practitioners and patients at a disadvantage when trying to make informed decisions to form a risk-benefit ratio. With further research is also required to determine the efficacy in non-Caucasian populations as well as populations with previously existing coronary conditions. Overall, Vernakalant is a very effective drug for the rapid cardioversion of atrial fibrillation, though it does need more research into its safety. I have been Tyson Smith, and I've been helped by Luke Francis,